What if I told you that you could get a full-blown facelift and neck lift and recover and be back at work in about a week? Well, welcome to the world of rapid recovery facelift and neck lift. Hi, this is Dr. Roy Kim, and I'll be sharing my insider tweaks as well as the secrets to achieve this. As a plastic surgeon, one of the biggest things that I do are facelift neck lifts. That's one of my most popular procedures. Now, having said that, over the years, I've learned that there are little instances that, if you accumulate them over time, will help you recover a lot faster. So I think that preparation is the key to the fastest and most efficient recovery. Preparation means not just me, but also you. Specifically you, if you're the patient. The more education you have, the better off you are, and I think the more rapid your recovery will be. In terms of your overall health, avoid blood thinners and discuss this, if needed, with your own family doctor before you actually have surgery. I do not operate on smokers, but if you are one of those patients that does smoke, your plastic surgeon may want you to stop smoking 1 to 2 months before your facelift and neck lift surgery. You need to stop drinking alcohol about 2 weeks or more before your surgery because alcohol tends to thin out your blood. Discuss this, of course, with your plastic surgeon as well as other medications you may be on. But yes, we want you to be prepped before your operation. Next, you want to prepare your home. You want to have a clear path to the bathroom. You want to make sure you have high nutrient, high protein food. You want to make sure you're not too bored while you're recovering. So make sure that your Netflix subscriptions are up to date and you have some books. You can listen to your favorite music, things like that you enjoy doing to get the best recovery after your facelift neck lift. Now, I do think that the most important thing to recover from a facelift neck lift efficiently and in terms of rapid recovery is to really understand what you need. The larger procedure will unfortunately have a longer healing time. If you want to have a shorter recovery time, you will definitely need to think long and hard about how many procedures you want. So for example, if we're doing a straightforward facelift and neck lift, especially with the deep plane method, there's a little less dissection and you should be able to recover pretty quickly. If you're getting upper and lower eyelids, fat grafting, brow lift, and other things, the more procedures you get, the longer the healing time. Now, of course, we're going to try our best to get you to rapid recovery, but just be aware that the more dissection, the more procedures, the longer it takes in the operating room, the longer the recovery time is going to be for every patient. After surgery, it's also important to help reduce swelling as much as possible. So I would ask you to elevate your head above heart level, to use ice packs as needed, and possibly to take certain supplements. I do think that bromelain, which is derived from pineapple, taken right before surgery as well as afterwards, helps to reduce swelling and may actually help reduce bruising. Arnica, echinacea, other things like that are more homeopathic. Conflicting studies about whether they really help reduce swelling and bruising as much, but generally they don't hurt and they may be helpful in your situation. Gentle lymphatic massage may also help right after surgery. So walking around, being hydrated helps, but also lymphatic massage to help reduce the swelling around your face and neck area, or more specifically to actually reduce the swelling of your upper body and get it out of there, may help you as well. It's very important not to have strenuous activity to really elevate that heart rate or blood pressure right after surgery and probably for the first 2 weeks or longer after your facelift neck lift. Post-surgery, I think the biggest thing is to make sure that you're not in pain and to make sure that you're comfortable. So I do use a special concoction of injectable numbing medicine at the end of your operation, so you're definitely in a lot less pain for the first 3 to 5 days after surgery. I think it's critical to be in less pain with the first 24 hours because your body can really accommodate to your new face and your new neck. For skincare, it's actually pretty easy. We want you to just use antibiotic ointment over your incisions because this will actually help you heal faster. It will prevent the risk of infection and actually make your scars look better. After a couple days, we'll start you on a gentle skincare regimen or routine so that your skin can really hydrate. It'll increase collagen growth and we want you to heal up well. For those interested in really accelerating the recovery, hyperbaric oxygen is an option. So I don't think it's mandatory, and the studies have been a little inconclusive where hyperbaric oxygen, which is a lot of oxygen in terms of your body, really helps to, in some cases, help with healing. With facelift and neck lift surgery, I have not really seen great studies with lots of patients over a longer period of time, which has shown that it's really accelerated a lot. Now, will it help a little? Absolutely. And this is why I recommend it for those patients who really want to have rapid recovery after the facelift neck lift. Sutures are typically removed about 7 to 14 days after your operation, and then we will start you on a scar care regimen. In other words, silicone gel bandages and similar things like that to really help your scars heal up. So this way you can camouflage your appearance, and with your hair down or even hair that is normal length, we can actually hide your surgery and get you back to a rapid recovery and work, life, and just having fun as soon as possible. With these rapid recovery techniques after facelift and neck lift, we want you, yes, to be able to turn back the hands of time by 10 years or more, and also get back to life as quickly as possible. Remember, the key to successful recovery after facelift and neck lift is to prepare yourself, to make sure that the procedure that you want is limited in dissection but still something that you need, and making sure that you take care of yourself after surgery. I have a video here on how to increase collagen growth naturally, which is very important after your operation and pretty much in any facial procedure that I know of. If you have any questions, please let me know. If you have ideas for other future videos, please let me know. And as always, thanks so much for watching.